the fear of this deep vein thrombosis is that if the blood clot dislodges from the leg or from the arm and finds its way in the lungs, it will cause obstruction within the blood flow to the lungs, and that is a life-threatening condition. It can lead to death. Hello and welcome to my platform. How often do you hear that someone who was looking apparently well, healthy, boarded a flight and upon arrival at the destination suddenly passed? I want to talk today about a condition called deep vein thrombosis, a condition whereby a blood clot forms in the deep veins. This can happen within the veins in the legs, it can happen within the veins in the arms. What actually leads to the formation of this clot? Three things, come together to put people at risk of formation of blood clots. One, blood flow stasis. So blood is not flowing the way it's supposed to flow. Injury to blood vessels. And the third one is what we call a hypercoagulable state, which means that you are at a state where you are at risk of forming clots easily. So when those three things come together, the potential for clot formation is higher. Talking about blood flow stasis, what are some of the things that can cause blood flow stasis? In the video I uploaded yesterday, I talked about venous insufficiency and I explained the mechanisms by which blood flow returns to the heart. And I also said that if blood does not return to the heart through the veins as it should, blood is going to accumulate. For example, I talked about in the legs, right? Blood moves from down to up and it goes against gravity. And so for blood to move from the foot to the heart, it needs the venous pump mechanism in the legs as well as the valves in the veins of the legs to function well. And if anything obstructs these, then blood can accumulate in the legs and blood will not go to the heart as it should. When this blood accumulates in the legs, there is a risk of blood clot formation. This is what is called blood flow stasis. So what are the risk factors for development of these blood clots? Immobilization, right? It means like you're not moving about like you should. Like people who are hospitalized for prolonged periods, or people who are acutely ill at home and stay in bed for quite a while. People who have cancers are at risk of developing blood clots. The risk increases with age. So people above 65 years of age are at higher risk. Medications like oral contraceptives, they are trauma. So people who have had maybe a fracture or, had a cast placed on the leg, they are at risk of developing a clot within the legs, because all of these, like I said, they come together with these three things: blood flow stasis, injury to blood vessel, and hypercoagulable state. Smoking is also a risk factor. There are other inherited disorders that predispose people to having blood clot: sickle cell disease, the thrombophilia. Now that you know the risk, right? Now, and at the start of the video, I mentioned long flights. So let's say you bought a flight and let's say you're an active smoker, you bought a flight, maybe an 8-hour, 9-hour, 10 hours flight to another country, right? And throughout the flight, you are just sat on one spot, no movement of the legs. And like I said in the video yesterday, when you move your legs, right, the muscles of the foot and the calf, they contract, and this helps to push blood to the heart. So not moving the leg, for that long can promote what I mentioned earlier, blood flow stasis. And throughout 9 hours, if you have increased risk of blood clot formation, a clot can form there. And when you arrive at your destination, as you start moving, that clot can move from the leg to the lungs, and that is the fear of deep vein thrombosis. Because if it gets to the lungs, it's a life-threatening situation. It's a medical emergency. Warranting immediate care, and it can lead to death. Now, how do you know that you have a deep vein thrombosis? Let me talk about a deep vein thrombosis of the legs, right? Three characteristic things that you should have definitely, because now what happens is that there is a blood clot within the vein, so it blocks blood from flowing. So blood will accumulate, so there is swelling. The next thing is pain, and the area is usually very red and warm. Now, looking at that alone does not tell you that that's a deep vein thrombosis, okay? Because in another video I made, I talked about cellulitis. So classically, you have similar symptoms in cellulitis. But another thing I mentioned about cellulitis is that there's always a portal of entry, like, recent injury, something pierced your leg and stuff like that. But let's stay with the deep vein thrombosis. So those are the symptoms, right? Most often, deep vein thrombosis affects one leg, but it can affect both. Okay, so if you have that, it's important you see a doctor, because scans will be done as well as blood tests, and of course you'll be put on medication for a long time, initially 3 months and even longer. I also mentioned compression stockings yesterday in helping move blood flow back, from the legs, especially if, you have a venous insufficiency. It helps, in preventing blood flow stasis. Blood flow stasis, like I said, implies blood is just accumulating in one spot. It's not moving like it should. So having the compression stockings can help, push blood up. So if you have risk factors for deep vein thrombosis, right? I've mentioned those factors: age, cancer, smoking, obesity, recent trauma, recent hospitalization, recent surgery. Those are some of the risk factors. In addition, hormonal contraceptive pills, and then other, inherited disorders like sickle cell disease, thrombophilias. Those are risk factors for deep vein thrombosis. It's important, like if you have to board a flight and while on the flight, it's important, to have a compression stocking. It can help you. And also during the flight, adopt the attitude of maybe just moving the limbs, because this helps with contraction of the muscles of the foot and the calf, and this propels blood back to the heart. So if you found this video helpful, why not give me a like, share, and stay tuned for more. Thank you.